Welcome to Derby Teaching Hospitals NHS Foundation Trust. You're about to see the journey a healthcare professional might take from an expression of interest at a recruitment evening right through to 6 months post-induction. The journey you're about to see is for a paediatric nurse but can be applied across all areas within the trust. Your first contact might be at a recruitment evening where local educators and senior staff are on hand to give you an overview of the services and opportunities available in those areas. You will also be given details of the application process and when to apply for the jobs in relation to when you qualify. Hello there.
Hi ladies. Hi, my name's Emma and this is Sean.
Hi, I'm Alice, this is Anne.
Hiya. So when do you qualify?
In September.
In September, you excited?
Bit nervous.
Bit nervous, yeah, apprehensive. Yeah. So you're interested in working at Derby?
Yeah.
Yeah? Have you been to Derby before? Have you had a look round?
No, not really.
No, that's something that we can arrange if you wanted to come and have a look round. Yeah. So what kind of placements have you had during your training?
We've had surgical,
Yeah.
intensive care, or things like that, A&E, outpatients.
You enjoyed them all?
Yeah, I like
Yeah.
like A&E kind of more
Yeah.
trauma sort of things.
Okay.
Things like that.
Yeah, we've got a children's emergency department at Derby. Yeah, it's quite busy as you can imagine. So we've got lots of different departments as you can see on the board. We've got 3 ward areas, 3 inpatient areas. We've got Puffin, Dolphin and Sunflower wards. 2 of those are medical. One of them's got a HDU attached to it, so that's Dolphin, and then Sunflower's your surgical ward. Obviously we've got the children's emergency department that I've just told you about. We've also got NICU, which is where Sean's based. And then we've got children's outpatients, the community team, the kite team. So, and what we tend to do is offer rotation, especially for those who haven't worked at Derby, because you want to make sure that you've kind of seen all the different areas and kind of give you that nice consolidation of your training, because you don't always know where you want to work.
I do like A&E, but
like A&E.
you don't know how different it is between being a student and a qualified.
Absolutely. Sometimes what we'll do is put that at the end of your rotation, so it gives you can consolidate your training in the ward areas and then move on to children's emergency at the end. So that's something that we can look at definitely. So we do offer that as part of the rotation programme.
That sounds good.
Yeah. We offer the preceptorship obviously all the way through.
Yeah.
And you'll get allocated a preceptor in each of your areas, so that's something that we do offer. We have children's preceptorship packs as well as the trust preceptorship pack as well. So that's something that you can work through while you're in your first year and study days throughout that year as well. Does that sound like something that you'd be interested in?
Yeah, it
Yeah?
does sound good.
Like I say, you can arrange and come and have a look around, and we're quite happy to facilitate that.
Yeah, if you take all these cards on the back are our details, so if you just drop us an email, we'll be able to sort of visit out any time.
Thank you.
Once appointed, the educators inform the current staff in the areas of the preceptorship role and the requirements and responsibilities of the newly qualified healthcare professional.
Hi Laura.
Hi.
How are you?
I'm good, thanks. You?
Yeah, fine, thank you. Yeah. So you've got Alice starting next week?
Oh yes, the newly qualified.
Yeah. You met her, I think.
Was it the coffee morning?
Yeah, the one that we had last month.
Yes.
Yeah. How did you find that?
It was really useful,
Yeah.
actually. Yeah.
Yeah.
It's good to sort of give some advice to the new starters.
It's quite daunting, isn't it, being
was,
newly qualified?
They look petrified.
Yeah, they did. Bless them. Yeah. So here's her preceptorship pack.
Lovely.
That you'll need to. I think you've hopefully seen that.
On the
before.
preceptorship study day, was that?
Yeah. Did you go to the full day?
Yes.
Yeah, brilliant. So you'll need to go through that with her and explain the process of that, and the local induction paperwork's in there as well.
Okay.
So going through that with her when she first starts. Obviously she didn't train here.
Okay.
So it's just giving her a good orientation to Derby. So make sure that you go through that. She'll have a couple of weeks supernumerary to go through that orientation.
Good.
Are you on nights and things?
Yes, I've got a few coming up.
Yeah, so she can do those nights with
Okay.
you. So she can see what nights are. I'm sure she'll have done nights during her training, but go through those with her. On her first week, she'll have done her induction programme.
Okay.
So she'll have done all her mandatory training, including a resource.
Okay.
And she'll have done a full medicine study day as well. So that's the full package with just going through how we do things with at Derby in relation to medicines.
Will she have a medicine pack then to complete?
She will, yeah. But she won't be able to do that until she's got a PIN number,
Right.
which can sometimes take a few weeks for that to come through. So that will have an impact on her practice as well when she first starts. There's a list of study days there for her
lovely.
that kind of go through the next 6 months. So if you, she will have a list of those as well when she first starts. So it's just making sure that she requests those so she can make sure that she's off the ward for those. Of IV study days on there as well. So that's about 3 months into that. IT training, she'll have that during a supernumerary period. We don't do that in that first week because it's quite jam-packed with mandatory training, as you can imagine, and the medicine study day. So she'll have that in a supernumerary, so she'll have to be off the ward for about 3 hours for her IT training, but then obviously she'll be up and running to get on all the IT systems.
Brilliant.
All right, is there anything else you want to know?
I think that's it.
We will offer you mandatory training which is specific to your area. One element of this for paediatrics is basic life support.
Baby Annie, can I have some help, please?
Oh, you're right. What's happening?
Yeah, this is Baby Annie. You've just been asked to come and help out. I don't think she's breathing at all. I think we might need some more help.
I'll go and pull the buzzer.
Yes, please. Yeah. So the first thing we do is make sure it's safe to approach. Okay.
That helps on the way.
Thank you very much, Steve. So what I'm going to do then, I'm just going to look in the mouth, make sure there's no obstructions. So the airway is nice and clear. There's nothing including the airway there. I think we need to look, listen and feel and make sure that this baby's definitely not breathing. So I'm going to listen for 10 seconds. Looking, yep, she's definitely not breathing. Can you get a bag of masks for me, please, Steve?
There we go. Let's connect to the oxygen for you.
Thank you very much.
There you go.
So what we need to do now is we need to give some rescue breaths, all right, guys? So what we're doing, we're putting the mask on, and that needs to be not extended over the edge of the chin and not protruding over the eyes as well, all right? So we're covering both nose and mouth. So what we'll do is we'll come in and approach from the side. Obviously, you need to make sure that the area is safe to approach, and then just go through it systematically, just exactly the same as I did. Is that all right?
Okay.
Yeah?
That's fine.
Great.
Annie, can you hear me? Annie, can I get some help in here, please?
Hello, Alice, you all right?
Hi, this is little baby Annie. She's stopped breathing. I don't think she's being quite unresponsive.
Okay, what I'll do is I'll go and get some more help, yeah?
Yeah, I'll look, listen and feel. Yeah, she's not breathing.
Okay, help's on its way.
Thank you. Can you just plug that in?
Of course I can. Yeah, I'll just put it into the oxygen. There we go.
There's no obstructions. So we do 5 rescue breaths, and are you all right to start?
Yeah,
chest
absolutely,
compressions?
yeah. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 12, 13, 14, 15. 1, 11, 12, 13, 14, 15.
Has a medical team got here yet?
They're on its way. So obviously we'll continue
We'll
this
just keep
until the
going.
medical team arrived.
On your first day, your preceptor will be on hand and will perform a local induction.
Hi Alice.
Hi.
So today's your first day in the ward.
Yeah.
How are you feeling?
A bit nervous.
That's okay. So I'm Lara. I don't know if you remember we met at the Preceptorship coffee morning.
Yeah.
I'm going to be preceptor, so you'll be working with me and I'll be supervising you. We've just got a few things to run through today, so I'll show you around the ward in a minute. Obviously I can see you've got your uniform, and have you got your security badge?
Yeah, and my SWAT card.
Brilliant, and that lets you onto the ward okay?
Yeah, fine.
That's fantastic. We'll run through some other things like normal working there on the ward shortly.
Okay.
Just want to make sure you're aware of some important things like what to do in an arrest situation, to know which number to call.
Yeah, it's 4-2s.
That's brilliant. Fire, obviously you follow the signs for the fire exit and you've got the correct fire extinguishers. Do you know who everybody is pretty much on the ward?
Not really.
Okay, we can go through with people that are on shift
Okay.
today. You've had your induction week.
Yeah, that was last week.
So you've had a lot of your basic mandatory training, so that's brilliant. So today on the ward, obviously we'll be sharing a patient load, and we've got some things like discharges, we've got some patients that need to go off the ward for investigations, so I can show you some other areas in the hospital as well, so I'm guessing you don't really know many places. Okay, that's brilliant. Then have you got any questions?
Just about like documentation and annual leave and this thing called e-rostering.
Okay, yeah. So I can show you how to access that on the computer. Have you got IT access?
Yeah, I just don't know how to use it.
And you can request all your shifts on there as well and put your annual leave in, and that will be authorised. So should we show you around the ward?
Yeah.
Okay.
Another key element during your preceptorship is IV training, and after a theory day you'll have the opportunity to practice under supervision and complete a workbook before practicing unsupervised.
Hi Alice.
Hi.
So today I'm going to supervise you making some IVs up.
Okay.
Did you have your IVs today last week?
Yeah.
And have you made any IVs up before at all?
Yeah, when I was a student.
So you know your basic A and T principles and things like that. Okay, so do you want to have a go at making some up today?
Yeah.
So we're going to make this antibiotic up. Do you want to have a go at drawing the required amount of water up?
Yeah. Should we check the prescription first?
Oh yes, good idea. So have you seen EPMA before?
Yeah.
So your antibiotic will always come up here, and obviously it's got the times and the correct dose as well. So that's your dose that you need to follow.
Okay.
So give your top a good wipe down. And then you need to let that air dry for 30 seconds so you can draw your water up in the meantime.
Checked it.
Brilliant. So if you draw the required amount of water, making sure there's not too many bubbles in there.
Is that all right?
Yep, fantastic. So that should be dry by now. And if you put all of the water in and give it a good shake. And then obviously keep referring back to your prescription as to what dose you need to draw back. Fantastic. So you discard your sharp into the correct sharps bin. Yeah, if you put a stopper on. And this type of antibiotic needs to be infused over a pump.
Okay.
So we've got these new pumps that we're starting to use now, and it's called the Archimed. Once you turn it on, you need to select the correct setting. So obviously ours would be paediatric, and then within that you've got a list of all the drugs that we infuse.
Okay.
So it's a lot safer than the old ones.
6 months post-induction, we have an informal catch-up and discuss how you're getting on and opportunities for moving forward. This normally includes chasing up packages, offering the mentor course supported by one of the local universities, and a chance to discuss the Preceptorship study days offered by the Professional Development Unit team.
Hi Alice.
Hi.
How have you been getting on?
Right.
So you're 6 months qualified
Yeah.
now. Have you been enjoying it?
Yeah, I'm getting a bit more settled in, I think, now.
Great. And have you found everything on the ward?
Everyone's really friendly, and
Brilliant.
I don't feel scared to ask them questions or anything. They, anyone will be willing to help with anything. I don't feel like I have to go solely to my preceptor.
That's
Everyone's
reassuring.
been really helpful.
And have you found coming to a different hospital?
It was a bit scary at first because they'd asked me to go places and I hadn't got a clue where they were. But once I've found my feet and found where like pathology is and the cafe and things.
Important stuff.
Yeah.
You know where to go. Brilliant. Have you managed to complete your competency packs that you were set when you first started?
Yeah, I think so. I think I've
completed
pretty
your
much done
meds?
them all. Yeah.
How about NG packs?
I did struggle to begin with because obviously we don't get many NGs on this ward, but I've managed to.
Did you go to another ward to
Yeah.
complete them? So that's good. So brilliant. Is there anything outstanding that you feel you need to achieve or you want to achieve at all?
No, I'd like to get a bit more practice with NGs, especially if I'm going to rotate to a different ward where they do use NGs a lot. It'd be nice to be a bit more confident before I get there.
Absolutely. Brilliant. And you said earlier that you felt supported
Yeah.
and you feel like you can go to different people.
Yeah.
So that's really good. Have you felt you've settled in with the team?
Yeah.
Okay, yeah.
I feel like I've
Brilliant.
just slotted in.
How you enjoy living in Derby?
It's a lot smaller than what I'm used to, but they've got everything. So you've got like your cinema, your shopping centres, and you're quite close to Nottingham, Leicester.
So you can go with that.
Yeah.
Have you
Not
managed
far.
to fit in all your social activities,
Yeah,
still seeing your
managed
friends
to
and things?
Squeeze in my Monday night diving.
Brilliant.
Yeah.
So that's something to concentrate on as well and clear your mind, isn't it?
Yeah.
How about annual leave? Have you managed to
Yeah,
take
booked
some
a
of that?
bit. We've got a holiday booked for the next couple of weeks.
So you can clear your mind
Yeah.
and get some rest. Brilliant.
It's been good.
We hope this video has given you an insight into the journey of the newly qualified healthcare professional, from expression of interest through to 6 months post-induction here at Derby Teaching Hospitals NHS Foundation Trust. Should you require any further information, please contact us at this address.